What were the historical challenges of TB in pregnancy? Imagine facing a disease that not only affects your health but also risks your baby's well-being. That has been the reality for many women with tuberculosis throughout history. Tuberculosis in pregnancy has always been tricky because of how the disease interacts with the changes your body goes through when you're expecting. One big challenge was diagnosing TB early enough. Pregnancy symptoms like fatigue, mild fever, or weight loss could easily be mistaken for normal pregnancy signs, leading doctors to miss or delay diagnosis. In the past, doctors were also cautious about using chest X-rays during pregnancy because of concerns about exposing the fetus to radiation. This meant that detecting lung infections was often postponed or limited, making it harder to catch TB early. Treating TB during pregnancy was another complex issue. Many of the first-line anti-tuberculosis drugs, like isoniazid and rifampicin, raised concerns about safety for the developing baby. Some medications could cause birth defects or liver problems in the mother, which made doctors hesitant to start treatment immediately. Often, treatment was delayed until the second trimester to reduce risks, but this delay could allow the disease to worsen. Treating multi-drug-resistant TB was even more challenging because second-line drugs tend to have more side effects and are less studied in pregnant women. This created a difficult balance between controlling the disease and protecting the fetus. Untreated or poorly managed TB in pregnancy led to serious outcomes in the past. Mothers faced higher risks of severe illness or death, and babies were often born prematurely, with low weight, or even lost before birth. The immune system changes during pregnancy can make TB worse or harder to treat, and the medication's effectiveness can be affected by how the body processes them during pregnancy. Because pregnant women were often excluded from clinical trials, there was limited research on how best to treat TB safely in pregnancy. This lack of evidence meant that healthcare providers had to be very cautious, sometimes leading to less effective treatment plans. Social factors also played a role. Pregnant women with TB often face stigma and isolation, which made it harder to access care or stick to treatment. In many regions where TB was common, health systems lacked integrated services for maternal health and TB, making management even more difficult. All these challenges meant that for a long time, TB in pregnancy was a serious public health concern, requiring careful assessment of risks and benefits. Today, thanks to advances in medicine, we have better treatment options and monitoring strategies, and more pregnant women are included in research. Still, understanding the historical difficulties helps us appreciate the importance of early diagnosis, safe treatment, and comprehensive care. If you or someone you know is pregnant and concerned about TB, always consult healthcare professionals for personalized advice. Medical science continues to improve, but the goal remains to protect both mother and baby through careful, evidence-based management.